India's official tally of daily COVID-19 infections has been falling in the past few days, offering hope that its second wave is ebbing. But there are serious concerns that many new infections are not being reported, and this is largely due to a dearth of testing in the countryside. By some estimates, over 60% of the new cases are now surfacing in the villages. Well, our India correspondents like Rohini Mohan will have stories out tomorrow showing the situation in the rural parts of the country. Rohini is here to share more on her piece. Rohini, welcome back. You were in Chamarajanagar, about 175 kilometers from Bangalore. Now, it's one of several rural areas hit by COVID-19. Are you able to describe the situation over there?
Yes, I went to this place, which, as you said, is about actually 5 hours from Bangalore, where I am. And this is a place that on May 3rd saw the death of 24 people, 23 of them who were affected by COVID in the hospital because of an oxygen shortage. Oxygen ran out at midnight, and all of these people who were in the oxygen and ventilator wards just died overnight. And since then, oxygen has been fixed, but it actually highlighted a grave shortage of resources and also the rising number of cases in rural areas. When I went there, I saw every COVID bed occupied, and there were even people that were on the floor attached to oxygen supply. Then there were very few nurses and doctors to handle this number of patients. India has a shortage of doctors with 0.8 for every 1 lakh for every 100,000 people, and this is even less in rural areas. And this is in South India, where now of the 30 worst hit districts in rural India, now 20 are actually from South India.
Right. Well, let's look at, I guess, the growing crisis in the villages, in the rural parts of India. For a while, India's COVID-19 cases were mainly confined, so to speak, to the big cities, in Delhi, for instance. So you were previously on the show to talk about that. Going forward, and I guess assessing the situation now, how did the virus get into the villages, and were there any measures already in place to prevent such occurrences?
Actually, there was a strong belief that rural areas, because of the open areas and fewer population and less dense villages, a lot of us believed, and the experts believed, that rural India wouldn't be so affected. But ever since lockdown was imposed and after the first wave, there was a drop in cases, there was more mobility in the country. So people did move back to the countryside, those who were migrant workers when they lost jobs in the cities. Many of them moved back home to rural areas. And remember, 65% of India lives in villages. That's around 90 million population. And this is quite a large number. There's also, secondly, so when people went from cities to rural areas, they took the virus with them. But in the rural areas, the infections spread because there has not been as much of communication or effort to improve mask hygiene, social distancing, and also things like isolation centers, home. I met many people who admitted that they didn't know how to isolate at home. Many of them were also afraid of the stigma of COVID, so would not isolate even if they were COVID positive. And the third reason is that this, for the fast spread in rural areas, is that many of the infections now are happening in the midst of India's acute shortage of vaccines. So although there are more number of vaccine sites, there is places where people can go to get the jab, in rural areas, the supply has been skewed for the last 4 months to the urban centers. So they don't have access to vaccines to protect themselves from severe cases of COVID, which has meant that the death rate has been pretty high. And the last reason is that the infrastructure upgrade, like adding oxygen concentrators, putting more beds, creating COVID care centers for mild cases of COVID, all of these were focused again on cities which were the worst hit in the first part of the first wave last year in March 2020 to September. And also now in March and April, it was concentrated in cities. So the efforts to fix this infrastructurally also were skewed to the cities. And now the rural areas are affected because of, in a way, negligence.
Right. Well, I can imagine a village's healthcare system must be under immense pressure, under the growing caseload, and it's something that you will address in your story tomorrow. Aside from that, Rahini, what more challenges do villages face in managing the pandemic compared with India's cities?
Asking health workers there, they had a litany of complaints actually, because they were really stressed trying to communicate to people in villages who are very afraid of COVID, but actually not serious enough about how to prevent it in terms of mask wearing, in terms of social distancing. Very little of this hygiene, cough etiquette. Very little of this is followed. I followed a health worker in the Chamarajanagar district who was trying to visit a village to test people because in that village there were two people who had turned positive and one of them had died. So she wanted to go and test as many people as possible, especially the primary contacts and others in the village. But she said that people were running into the forest, people were going up the hills and also abusing her and chasing her away because people were afraid of being declared to have COVID. Secondly, many of them they live very far away from the centers where vaccines are given, and also are not fully sure. There is a lot of vaccine hesitancy. They're not sure what is the use of the vaccine. They're afraid of the fever and some of the side effects that come after taking the jab. So these fears have not been really addressed. There is a lot of effort happening from the government side now, focusing on rural areas. But these are some of the awareness gaps, infrastructural gaps, and also the shortage of resources in terms of manpower and also hospital infrastructure that are making the fight really hard in villages in India.